come in.
Hi, I'm Julia. I'll be your student nurse today. As I walk in, I'll close the curtain and provide privacy along with washing my hands. Then as I come up to the patient, I'll ask them to validate their name and date of birth for me, please. Could you please validate your name and date of birth for me?
Bryn Vollum, 7/12/2003.
Perfect. So today we're going to be doing a head-to-toe assessment, which is just going to make sure that everything from your head to your toes is all healthy. So do you feel comfortable with allowing me to do that with you today?
Yes.
Perfect. To start, we'll just start with the general assessment. So how are you feeling today?
Pretty good.
Do you have any pain anywhere?
No, not really.
Okay. Feeling anything abnormal in the past few days or since you came to your last checkup?
No, I mean, I'm a little bit sore from exercise, but.
Okay. Sounds good. What's your living situation like this year?
I live in a house with 3 roommates, and it's going well, I would say.
Feels good? You feel safe at home?
Mm-hmm.
Okay. Do you have a partner of any type?
No.
Okay. Sounds good. Thank you. So to start the head-to-toe assessment, I'll start at your head. And as I'm looking at her hair, I've assessed that she has clean hair. She's been taking showers regularly and seems to groom herself normally. As I move down her head, I look at her ears to check for symmetry and discoloration, along with there being anything inside of the ears that looks abnormal. As I move down her face, I'll palpate her sinuses to see if there is any pressure that I can feel from the outside or if she shows any symptoms of pain. I'll also check her eyebrows, eyes, nose, mouth, and neck for symmetry. As I'm also looking at her eyes, I would have a pen light to check the dilation of her pupils. As I'm checking the dilation of her pupils, I'll also look at the whites of her eyes to see if they look as though they are healthy. Then I'll ask her to follow my finger. Perfect, thank you. I'll also take the pen light to examine up her nose. Can I look up your nose?
Mm-hmm.
Okay. And look for any obstructions of her airway. It doesn't look like there are any. If you could open your mouth for me. Perfect. You got your tongue. Say ah.
Ah.
Thank you. Okay, as her teeth and her mouth both looked cleanly, and they looked as though she'd been grooming normally and taking care of her hygiene. So as I move down her body, I'll also look at her collarbones for symmetry, which they feel symmetrical. And I'll move down her arms, just looking at her chest, looking at her stomach, looking at her legs, making sure that everything looks, smells, and feels normal. Then I'll start by palpating her chest. So I palpate her chest, feeling for any bumps or anything that seems out of the regular. I'd also probably take off her gown and ask to look at the color of her chest, but we won't be doing that today. Now I will move forward by listening to your heart sounds. Alright, do you feel comfortable with me listening to your heart sounds?
Yeah.
Okay, so I'm going to start with one side of the stethoscope. Perfect. Now I'll flip to the other side of the stethoscope to see if there's any deeper, sharper noises that I couldn't hear with the other side. Perfect, that sounded great, nice and strong. Now that I have you sitting up, I'm also going to check your breathing sounds from the front and the back.
Okay.
So every time I move my stethoscope, if you could just take in a deep breath in and a deep breath out. Okay, and then I'm also going to check for your back, so if you could turn to the side for me. Thank you. And now I'm going to listen with the other side of the stethoscope. Perfect. Now I'll move to the abdomen. So I'll start by listening to your GI tract and see if there's any gurgling sounds in there. So if you wanted to lay down. Perfect. I'll start in the bottom right quadrant. I'm sorry, this can be hard for people who are ticklish. Is it a little ticklish?
A little bit.
Okay. It's okay, it's okay. I can still hear if you're giggling. Perfect. Now I'm going to listen with the other side of the stethoscope. One more round. Perfect. Great. Good to hear things moving around in there. Now, if that was ticklish, this is probably going to be really ticklish, and I'm going to try and palpate your stomach.
Okay.
So I'm just going to feel for any bumps, lumps, anything that seems out of place. Have you been able to have bowel movements regularly?
Yeah.
Okay. I'm so sorry. It can be really ticklish. I would do the same thing.
Sorry.
No, it's okay. It's okay. All right. Everything feels normal, natural down in there. Perfect. Thank you so much. Now that I've finished your abdomen, I'm going to move on to your legs. So on your legs, it's okay if I pull up your pant leg. I'm just going to be looking for any discoloration, any edema, which would be like swelling in the leg or extra fluid. I'm going to be checking your pulses here, and then I'm also going to be palpating them. So I'll start by just feeling your leg. By what I can see, there is no discoloration. There's nothing out of place. Both of her legs look symmetrical as well, which is important. Then I'll move down and I'll feel the pedal pulse. On both legs. Check her pulse right here behind your bone. There's another pulse. Perfect, thank you. Awesome, thank you so much. Okay, and now I'm going to check your arms. So again, on your arms, I'll be looking for any discoloration, any lumps or bumps, anything that seems unnatural. Just by looking, I can see that she does have two very symmetrical arms. Here I'll also feel for the pulse. I'll feel for her radial pulse as well. And check for her capillary refill. Looking at the symmetry, coloration of her fingers as well. All right, as I move up your arms, everything looks pretty normal. I will note that she does have a tattoo on this side of her arm. That's the one unsymmetrical piece between the two. Did you have any trouble? When did you get this tattoo?
Like a month and a half ago.
Have you had any pain with it or any trouble healing?
No.
Okay. Okay, also gonna check the capillary refill on these fingers. Perfect. Now I would also obtain the pulse oximetry, the temperature, and the blood pressure of my patient, but I do not have the pieces here with me today to do those things. Thank you so much for letting me do a head-to-toe assessment on you today, and I will come back in and check with you soon.
Thank you.
I wash my hands as I leave.